This video is a demonstration of how to perform CPR on a child over the age of 1. We start by placing the child on a firm, flat surface. We then check their level of response by first talking to them and calling their name. Hello, Annie, can you hear me? Hello, hello. No response. We then squeeze the shoulders. No response. So we then pinch their ear. No response. The child is unresponsive. We then check to see if the airway is clear, putting one hand on the top of their head, opening their mouth and taking a look inside and clearing any debris that may be in the mouth. Once it is clear, place 2 fingers underneath the chin and tilt the head back to open the airway, and we're now going to check for breathing. We're going to place one hand on the stomach and place our ear down to the mouth, and we're going to look, listen and feel for 10 seconds. The child is not breathing, so we're going to use our speakerphone and call 999 and request an ambulance and tell them that the child is not breathing whilst we give 5 initial rescue breaths. We start by pinching the nose, 2 fingers under the chin, tilt the head back to open the airway, open their mouth, seal around the mouth and breathe in for 1 second, and we do this 5 times. Come up, see the chest rise and fall. If the child does not recover, then we continue with CPR at a rate of 30 compressions to 2 rescue breaths. Place one hand in the center of the chest, the other hand on top of the forehead. The shoulder should be in line with the elbow and the wrist, and we compress 1/3 of the chest and allow the chest to spring back up, giving 30 compressions at a rate of 100 to 120 per minute. Pinch the nose, tilt the head back, open the mouth and give 2 rescue breaths. Continue with compressions. And 2 rescue breaths. Continue with CPR until the child either recovers or help arrives. Having carried out a primary survey and you have found that your child is not responding and not breathing, immediately call for help and ask a helper to call 999 and collect a defibrillator. Ask for the ambulance service and tell them that the child is not breathing whilst you start CPR without delay. If you're on your own, use the speakerphone setting to call 999 and request an ambulance, informing them that the child is not breathing, whereupon you will commence CPR at a rate of 30 compressions to 2 rescue breaths and continue with CPR until help arrives or the child recovers. If you do not have access to a phone, give 5 initial rescue breaths. If the child does not recover, commence CPR for 1 minute to see if they recover. If there is no recovery, go to the nearest phone and bring the child with you. Call 999, inform them that the child is not breathing, and continue with CPR until help arrives or the child recovers. I'm now going to demonstrate the full primary survey and CPR on a child over the age of 1. So I start by assessing the dangers, looking around the child and above the child to see if there are any hazards. Once it's safe to do so, I will then approach the child and I try to elicit a response. Hello, hello, can you hear me, Annie? No response. I'm going to squeeze their shoulders. No response. Pinch their ear. No response. The child is unresponsive. I'm now going to assess their airway for any blockages. One hand controls the head. Open the mouth. Look inside the mouth. The mouth is clear, the airway is clear. I'm now going to tilt the head back, opening the airway. I'm now going to check for breathing for 10 seconds. The child is not breathing, so I'm going to take out my phone, put it on speaker, call an ambulance, and tell them that my child is not breathing. I'm now going to give 5 initial rescue breaths. Pinch the nose, tilt the head back, open the mouth. The child has not recovered. I will continue with CPR and 30 compressions. Two rescue breaths. I will continue with CPR until help arrives or the child recovers. And should the child recover, I will place it into the recovery position.